This is disturbing, to say the least. I guess this is for Mr. Garcia or Mr. Sheldon. How many different federal agencies are involved in cybersecurity responses?
Boy, that's a big question. I think the Department of Homeland Security, CISA, is the front and center, the Cybersecurity Infrastructure Security Agency, and for incident response. And then, of course, all of the other sector risk management agencies that deal with their given critical sector serve some role as well at various levels of maturity, sophistication.
Yeah, it's HHS coordinates with CISA, then ASPR through their SIP division leads the HHS efforts. You know, when I served on Homeland, we had, would do the cyber hygiene for public companies. Do you know if Optum or Change Healthcare went through cyber hygiene vulnerability scanning recently, or have they ever?
I do not know if they did.
Okay. United Health Group first announced the Change Healthcare cyber attack on February 21st, and yet it took the administration until March the 5th to put out a press release about a cyber attack that was impacting all parts of the healthcare system. Why do you think there was a delay in that? And anyone can answer this.
On behalf of the American Hospital Association, we were certainly keeping in contact with them to help them understand the gravity of the situation. They may not have recognized how much of an impact this was across the sector.
Yeah, huge impact. You know, there's reports that United Healthcare paid $22 million in ransom, but they haven't confirmed that yet. Does anybody know if they did or did not pay it? I know that you have a hierarchy of these ransomware companies, and they have shareholders. It's crazy, but what are they doing? You know, we know they're in it for the money, but what are they doing with our healthcare data? Can anybody tell me that?
Yes, ma'am. Generally, what they'll do is try to monetize that data.
Yeah.
So these foreign-based groups will, again, try to use the data to conduct other types of fraud, identity theft fraud, which can be used for other commercial frauds, or false billing. And we do have instances where hostile nation states will use that data for intelligence purposes to identify government employees, illnesses they may have, potentially use it for recruitment of government employees in sensitive positions.
This is crazy. And we had a breach. If you had government insurance not long ago, there was a breach there.
Correct. TRICARE was part of the alleged breach data here.
Yeah, this is nefarious. Mr. Rigi, how does changing clearinghouses affect healthcare entities?
So the clearinghouse is, again, part of that digitally interconnected ecosystem, and that is the funnel or the conduit that we would use for our revenue cycle to submit claims. If that's not available, of course, those claims back up. Eventually, like a pipeline, the funds coming back to us dry up.
Yeah.
So it is, again, financially, it is very devastating for the hospitals.
It is administrative cost and the timing, and
absolutely,
I understand that. I've been a pharmacist for almost as long as Buddy has, and when you deal with these clearinghouses, just like you, Dr. Brueggemann, I feel for you, because I know when you are waiting on payment to come through a clearinghouse, or you have central pay where they control what they put in or what they can take out, it's unbelievable. And you know, the vertical integration is a travesty. And I'll tell you, when we talked to ASPR and when we've talked, I've had many people comment to me, whether it's a hospital, pharmacy, or independent provider, they should have taken advance payments, should have been offered to these providers based on a historical average, maybe take the last 90 days average. Insurance companies should have suspended as many of these administrative hurdles as possible, like the prior approvals, filing deadlines, unique claim editing requirements, because what you're doing now is you're getting these denials because of the time frame. And but the prior approval claims weren't waived, the claims weren't paid, questions weren't answered, and this is a multi-billion-dollar company. And it's a pittance of what they gave to providers and pharmacies, and we're still waiting after 8 weeks. But what you said a minute ago, it's inconceivable that Optum purchased those practices during this crisis. And it's unbelievable that you're getting payments without getting an EOB or an explanation of benefits. How do you know how to reconcile your files or what your budget's go? And people are getting billed, so talk to me about that.
Yeah, I would tell you probably the worst number I heard from my team was that every time we have to reconcile a single payment, it takes us approximately 20 minutes from when we identify the payment to when we actually get it reconciled. So imagine that times every single payment, 20 minutes, every single payment, how many staff members we have to employ to get through the backlog. At some point in time, honestly, we're gonna probably just cut it off and say we can't even look backwards, we've gotta keep looking forwards because we just don't have enough staff and enough time to chase down all the dollars.
No, I agree. And this is forcing that one-payer system. If people don't think we have it, they better look closely. When you've got United Healthcare employing more physicians, owning the pharmacy benefit manager, your specialty pharmacies, we've said this all along. And we complained when CVS bought Caremark years ago, what's wrong with the FTC? And I guess my last question is, should we be urging the Federal Trade Commission to undertake retrospective merger reviews? And everybody can answer that.
I mean, I think the answer is absolutely. There's been some concern that vertical integration doesn't truly meet the definitions of monopolies. I think obviously we need to really consider how interconnected vertically integrated companies are.
Yes.
Yes, with particular consideration to the cybersecurity vulnerabilities we talked about earlier.
Yes.
I would agree, an examination of the cyber vulnerabilities when there is sector-wide impact such as this.
Apologies, no position. Agreed. If a merger and acquisition is going to result in higher security risk, that needs to be considered.
Yeah, absolutely. Thank
Emily
you for
yields
that.
back.